Hello, this is Dr. Dilip.V. Now you will be watching this short video about everything about asthma and allergy and lung disease on Sify.com. So happy listening and happy viewing.
What symptoms indicate a person requires pulmonary function testing?
Pulmonary function testing is a very elaborate package. It comes, but primarily when we talk about pulmonary function testing, we have in mind what we term as spirometry, which is available at Nahar Medical Center and which is available in most clinics today belonging to pulmonologists and at major hospitals. Conditions that need to be evaluated through a pulmonary function testing, that is spirometry, is basically for diagnosis of asthma and diagnosis of chronic bronchitis, which are necessarily airway diseases, or in evaluation of effects of smoking and pollution on the lungs, because they do affect airways as well. Evaluation of any bronchitis which can be allergic can be done by means of a spirometry, and essentially a diagnosis can be done by means of a reversibility testing where bronchodilator aerosols are given through the nebulizers to the patient to study the improvement, and the improvement, if it occurs to the tune of 15% in FEV1, 12 to 15%, he can be essentially labeled as an asthma. Patients who are on treatment for asthma and bronchitis also need to be evaluated periodically by means of doing a pulmonary function testing in order to find out whether the reversibility element has been reduced and the lung capacities, whether it has gone up and it is in the range of the personal best. So for monitoring, for diagnosis, for evaluation of patients, pulmonary function testing is an extremely important modality. Pulmonary function testing again has to be done in patients who are undergoing surgery, especially of the chest or of the upper abdomen, because if the pulmonary function is poor or inadequate, then it has to be improved by means of proper drug interventions and physiotherapy in order to make the patient capable of undergoing a surgery. And in sports medicine also it can be done in order to evaluate the abilities of the lung to assist the athlete to perform to his maximum. So in community as well as in office practice, as well as in hospital, in many diagnostic laboratories today, pulmonary function testing by means of advanced imported as well as Indian machines are giving yeoman service to patients of asthma, which can be easily brought into control by means of objective testing. In pulmonary function testing, as I told you, spirometry is done in clinics as well as in offices and hospitals. But one simple machine which can also test your airway function can be a peak expiratory flow rate meter. And this is the device which I wanted to show you, which is extremely light, handheld. Obviously, it depends upon the lung function as well as the function of the respiratory muscles, but this is one device which can help you to monitor the airway function. Yeah, this is the peak expiratory flow rate meter. This is an imported device. Unfortunately, the Indian devices are not to the mark, and this is extremely essential to manage any patient with asthma. Now, if you see, there are readings right from 60 to 800 liters per minute, and depending upon the reading, the individual treatment can be modified. Generally, an adult female will blow anywhere from 350 to 450 liters per minute, whereas the adult male can blow anywhere between 450 and 650. So any asthma has to be managed ideally not without a peak expiratory flow rate meter. I believe these meters are available for around 500 to 700 rupees, and they are very durable, and no asthma, just as you cannot manage diabetes without a blood sugar detecting device or measuring device, and you cannot manage hypertension without a BP apparatus. We find that a lot of general practitioner and physicians, especially general physicians, they are managing the asthma without the use of spirometry or a handheld peak expiratory flow rate meter. This is called as a mini peak flow rate meter because it is extremely compact, it is very light, and all you have to do is that you have to keep this device in the mouth and blow. Now before blowing, you have to take a deep long breath and then expel the air through the mouth into the machine forcefully, and you have to take 3 chances, and the best reading will be automatically shown by the machine. This is a rider which gets displaced because of your air flow, and the spring comes back, keeping the rider at the maximum place where the spring had stretched. This particular reading is extremely reproducible, and that will tell us that what is the level of obstruction in the airway. I will do this maneuver right in front of you so that you are aware that what should be your normal function. You have to take the rider at 0 level, take a deep long breath and blow forcefully inside the peak flow meter. Now, this is what I have achieved at my age. I was able to blow 600 liters per minute, obviously because I do not suffer from asthma. So in case this will be, if I do this 3 times and if it remains as 600, obviously my reading is 600 liters per minute. In patient of asthma, generally we find that the peak flow rates are very less, and if the individual's peak flow rate is nearly 50%, then he is definitely not controlled by the treatment which he is taking. Sometimes in acute asthma, the readings can go down as much as 200 and 100 and even below 100. That is a signal that this patient is extremely bad. You have to do oxygen saturation determination, and then maybe you will have to scale up the treatment in order to get quick response, even by giving injections, if you want to drastically prevent visit to the emergency room and even admission. So I feel that every asthmatic, especially who are having high element of bronchial hyperresponsiveness and brittleness, should possess one such meter, and these meters are very much available on the net, or for that matter at leading chemists in all the major cities.